We can hear you. I can hear you.
All right, thank you. Hi, everyone. I'm Mabo from the Combined Rural Residents Association, Zimbabwe. Today here, I'm presenting the preliminary findings of our research topic titled Assessing the Effectiveness and Impact of Statutory Accountability Mechanisms in Catchment Management and Water Service Provision. When we are measuring our accountability mechanisms, we are using 6 categories. The first one being responsiveness. By responsiveness, we mean action being taken by duty bearers after residents exert social accountability mechanisms for the duty bearers to improve service delivery. Number 2 being reactions. By reactions, we mean corrective measures being taken by duty bearers. And also, we have improved water services and catchment management. By this, we mean positive changes in terms of quality and quantity of water supplies for both municipal public water and the public water points. By public water points, we mean available communal boreholes. And also, we have gender inclusivity. By gender inclusivity, we mean the ability and capacity of women and the vulnerable groups to use social accountability mechanisms to demand services. By vulnerable groups, we mean the elderly, people living with disabilities, and the youth. And also, we are measuring change in policy. By change in policy, we mean positive shifts or changes in water-related policies or laws in compliance with the constitutional provisions after residents use social accountability mechanisms. And also the last 2 categories we are measuring is a change in practice. By change in practice, we mean noticeable changes in administrative conduct and compliance by the duty bearers. Next slide. The statutory accountability mechanisms being assessed on water service provision and catchment management in Zimbabwe, that is within our constitution, are petitions, court judgments, independent commissions, or ombudsmen. And also the legal background to this is that in our constitution of Zimbabwe, section 77, it's very explicit that the water is a human right. Section 77, it also emphasizes that there is a right to clean water, there's a right to clean environment. Section 77 provides also for the right to health. On petitioning, section 59 gives citizens the right to petition duty bearers other than Parliament. But in section 149 of the Constitution, it also says that the Parliament must consider any matter within its authority, including the enactment and amendment or repeal of the legislation. In terms of accountability, section 2 of the Constitution gives the right to citizens to access any information. The information is, if it is required in the interest of public accountability. Section 119 also states that all public institutions are accountable to Parliament. And section 68 gives citizens the right to administrative justice. On litigation, section 85 of the Constitution, Section 85 of the Constitution gives any person acting in their own interest on another person acting in the public interest through any alleged infringement of human rights. Next slide. Next slide. Oh, thank you. The independent commissions. The independent commissions are also called the Chapter 12 institutions in Zimbabwe. These are independent commissions, Zimbabwe Anti-Corruption Commission, the Zimbabwe Human Rights Commission, and the Zimbabwe Gender Commission. The local authorities also are established according to Section 275 of the Constitution, which are mandated to provide clean water according also to the Urban Councils Act, the Water Act, the Public Health Act. In Harare, the water service provision is the responsibility of the Harare municipality to do that. And the catchment councils are also established by the Zinwa Act, the Water Act, for the management of water resources. And also we have the Environmental Management Agency, which is established by the Environmental Management Act to oversee management of the environment, that is water pollution and environmental degradation. Next slide. The preliminary findings from our research that we got is that the human rights framework is influenced positive outcomes and judgments on water service provision and catchment management here in Zimbabwe. The positive we also have the positive judgments. The positive court judgments improved water supply and change practice among duty bearers and institutions. By institutions here, I mean public institutions. Petitioning Parliament on water and catchment issues enhances accountability and voices, but the process is too technical for an ordinary citizen. These were the findings that we got. Some citizens, they don't even understand the petition processes or even to have knowledge on how best to do it. And on catchment management, the land issue, it is a seriously politicized and contested area. The rich, the powerful, elites, and the politically connected are behind this destruction of the catchment areas or the urban poor. Also, the fear to petition or to take action due to fear of being victimized by these political elites. Going back to the one of the statutory accountability mechanisms that the residents use to demand water service provision, we have a court case whereby Combined Harare Residents Association went to court on the 31st of March 2019 for the seat of Harare. The respondents were the seat of Harare, the Minister of Finance, the Minister of Local Government, and the Minister of Health. The judicial decision that was made there, the judicial decision that was made there was in favor of CRA and the residents of Harare. And the order that was given by the court was that the government and the seat of Harare to immediately contract bulk water service providers to provide mobile water tanks to decongest community bores. I can take you back during that time, the 2019, it was the time where COVID-19 started, and water was very important, especially running water for citizens to maintain hygiene, as COVID-19 really requires continuous washing of hands with running water. So Harare City Council wasn't able to provide adequate water for the residents of Harare. So we went to court to compel for the court to compel the city of Harare to provide water for the residents. And also for the Minister of Finance, the court ordered that the Minister of Finance must release money to purchase water treatment chemicals to Harare municipality. Why was it like that? Because Harare City Council claims that they do not, the council doesn't have enough money to purchase water treatment chemicals so that it can be able to provide water adequately to residents. So the court ruled that the Minister of Finance must release money. And also the city of Harare was ordered to provide water during and after the COVID lockdown period. And also the city of Harare, after the court judgment, improved water product For the court judgment, the state of Harare was producing 170 megaliters of water, and it improved into 420 megaliters municipal pumped water. And also Harare City Council fixed about 86 communal bores to also improve water access to the residents of Harare. Mobile bulk water bowsers were also deployed in high density areas. And also we noted in the report for the Permanent Secretary for Provincial Affairs and Devolution in 2021 report, he also acknowledged that water supply coverage increased to suburbs such as Mavuku, Tafara, Greendale, and Sontosa after the High Court judgment. And also, we have realized that the city of Harare regularly updated CRA on the measures they are undertaking to improve water. These are some of the reactions and change of practices that Harare City Council adopted after the residents of Harare through CRA went to court to demand improved water service provision. Next slide. And also we have the case where Botwe Properties versus the city of Harare went to court after Harare City Council arbitrarily disconnect water to Botwe Properties. And also the court ruled that disconnecting water is unconstitutional. And currently, Harare City Council no longer conduct any arbitrary water disconnection because our constitution in section 68, it speaks of administrative justice. But Harare City Council just went on to disconnect water properties without following proper processes and procedures. So the court ruled in favor of the Botwe Properties. So currently we have noted that Harare City Council now have changed its practice. It no longer just disconnect water without following our procedures. And also we have noted that the city of Harare now is in the process of aligning its bylaws with the provisions of the constitution. That's a change in policy. And also we have noted that the city of Harare has adopted installation of prepaid water meters and is slowly shifting from conventional water meters. That's a change in policy and practice, the findings that we have realized. And also on petition, the residents of high density suburbs of Kambuzuma, the CBO called the Blue Agenda, a community-based organization. They petitioned Parliament on the service station that was built on a wetland. The Parliament responded and called this Blue Agenda CBO for a hearing, which eventually caused the Portfolio Committee on Local Government to tour the area. After touring, they made the recommendation that in order to save our wetlands in Harare, they has to have the development of a wetland map and the wetlands policy for Harare. This is one of the policy changes that we have noted after residents use one of the statutory accountability mechanisms, that is petitioning for the change of policy. And also, finally, we have independent commissions. Independent commissions, like I said before, are Chapter 12 institutions which are enshrined in our Constitution of Zimbabwe. Their main responsibility is to promote transparency and accountability in public institutions. And also, they must report to Parliament on particular matters relating to human rights and freedoms. But from the preliminary findings that we have, we got, residents reviewed that they have not engaged the commissions yet and they don't even know their roles, and they haven't heard about the human rights issues that the commissions have resolved on behalf of residents. So yeah, and briefly, that's the preliminary findings of our research. I say thank you.